Welcome to GMCS Masterclass, Medical Cannabis Essentials with Dr. Bid. Hosted by Dr. Hemant Bid, Program Director at Morehouse School of Medicine and GMCS Educational Partner. An educational series exploring the science, research and applications of medical cannabis. Dive deep into the latest developments in medical cannabis, patient care and clinical research. Brought to you by the Georgia Medical Cannabis Society, committed to advancing knowledge and improving patient outcomes. Tune in to GMCS Masterclass, Medical Cannabis Essentials with Dr. Bid.
GMCS Masterclass, Medical Cannabis Essentials.
Good evening everyone, and welcome to this exciting first session of GMCS Masterclass with Dr. Bid. And this is Dr. Bid. I'm a program director at Morehouse School of Medicine, and we are very excited to welcome all the audience to our GMCS Masterclass, where we started this series to give a knowledge, the scientific validated knowledge and the clinical updates that what's going on in the field of medical cannabis. So every week we are going to bring, in every episode that we are going to bring our guest, the specialists, the people who are the specialized in the medical cannabis, either in the research, either in the dispensary, either in the clinical side, either in the extraction or the testing side. So there are a lot of exciting information which is coming. So keep tuning on and be connected with us, because the focus and the aim of GMCS Masterclass is to educate the consumers, to educate the consumers, educate the clinicians, educate the researchers, educate the pharmacists, educate the nurses, that how medical cannabis is a valuable drug, as a main gateway drug which is coming in the forefront to help in so many different disease anomalies. So today that we have a first session, I'm very excited about our first session, and we have a very special guest with us, and we welcome Dr. Hodge, to our first medical cannabis GMCS session. Welcome, Dr. Hodge, to our first inauguration session at GMCS Medical Cannabis Essentials with Dr. Bid. So I welcome you and thanks for your time to be with us.
My brother, my colleague, my friend, let's have some fun. Thank you for the opportunity, man. Let's get into it, baby. And any questions, man, please put your questions are really important. It helps Dr. Bid and I learn. So please put them in the chat. We'll address them within the hour. If they're coming later, we'll email you some answers. But please share your questions in the chat.
Thank you so much for mentioning that, Dr. Hodge. And just for the introduction sake, I would like Dr. Hodge to just little bit give your introduction, your medical background, as well as your specialty and your involvement of when you started, how you started, so that we can start from there. And then after that, we can take a deep dive to discuss about the medical cannabis and the cancer, which is a really exciting field, because that's the cancer-related pain. And especially you are focused on pain and medical cannabis. So of course, that cancer-related pain is the part of the pain, and my field of research of medical cannabis, as well as a long-term experience of research in cancer drug discovery, will help the audience to understand that what is cancer, what's going on with cancer, along with that how in a various different settings that we can help cancer patients with the help of medical cannabis. Please, Dr. Hodge.
All right. Thank you, Dr. Bid. Well, hello, everybody. Again, my name is Rasean. I'm from New Jersey, went to Morehouse, went to med school back at Robert Wood Johnson in New Jersey, and came back to the Morehouse School of Medicine, where I completed family medicine residency. I've been practicing medicine for over 27 years now. In 2012, I broke my neck playing basketball, and that introduced me into my own personal journey with cannabis. Obviously, I found lots of success with all delivery methods, preferably inhalation, smoking and vaping. Second would be buccal under your tongue, and third would be edibles. For my chronic pain, and that kind of sparked the urge to help Georgians, caregivers, and patients that are suffering, and maybe cannabis, or maybe the flavonoids, the terpenoids, or maybe the whole entourage effect can help people with some of their with some alleviating some of their diseases and possible cure. In 2015, I got with lobbyists. I helped, with a big team effort. We passed Haley's Hope. That started the medicinal cannabis program. I was one of the first docs here in the good state of Georgia to start signing up patients and caregivers, bringing awareness. So yeah, that's where we're at. My practice is basically chronic pain. My second love is hospice and the life care. And I see a lot of cancer patients, a lot of sickle cell, AIDS, ALS, Parkinson's, Alzheimer's, you name it. I've seen it. So yeah, I got my master's in cannabis during the pandemic at the University of Maryland. And that helped me think critically. And this hour, we're going to think critically about how we can approach cancer and cannabis. So that's it. Can you hear me?
Thank you so much, Dr. Hodge, for your interesting story of your journey with medical cannabis, and definitely that I think practicing with medical cannabis, especially focus on pain, having the master's degree from University of Maryland, that helps a lot to understand that what this medicine is, and the critical and the complexity of this medicine with our body. So now today that we are going to talk about the medical cannabis and cancer. So I wanted to start from here for the audience, because multiple audience that I've been working in the field of cancer drug therapeutics from a long time, and one of the biggest questions that this always comes from the learners is that how you explain cancer, what is cancer? And I always tell them that cancer in the simplest way that you can explain that uncontrolled growth of the cell. So our body is a great machinery, and that needs a balance. So that means that when body is right, in a right space, so that means everything in a balanced way. And that's why that everything in a controlled way. But due to so many different factors, lifestyle changes, lot of different kind of eating that what we are doing, and then in today's world, and then the stress and so many other exposure of radiation, etc., that we don't know. We know so many factors in the field of cancer biology that which can affect and which can be the causal factor for cancer. But we wish, like Dr. Hodge or me as a cancer scientist also and a cancer doctor, that we wish we would know that what exactly the reason for cancer. But definitely there are some success in various different cancers. For example, that lung cancer, we have a specific antibody, epidermal growth factor receptors, because we know that epidermal growth factor receptor is the major causal reason for a certain percentage of the lung cancer patients. And if that mutation is present in the patients, with the help of sequencing, that when doctors detect that, then those antibodies are really effective in those patients. So definitely there are a lot of things going on in the field of cancer biology in the modern medicine. But if you think about that, what are the different kind of modern medicines are there? There are antibodies, there are small molecules, big molecules, there are peptides, etc. But then, from a long time, we are battling this battle with the field of cancer biology to give the treatment to the patients. And finally, we reach to that point that where all the scientists and the doctors and the innovator, that they decide that no, I think that like we need to go back to the human body and utilize the potential of human body. And that's how the immunotherapies come up, because then we are utilizing our own T cells to fight for the cancer, because cancer cells are the cells of our own body, which is basically that due to the exposure of various different factors, it is telling to the body that, hey, I am not in your control, I'm going to grow as much as I want, and I'm grow very rapidly. So then what happened, that it has the ability to tell our immune cells that, hey brother, I am your friend, because I was your friend, I was your family member in the body, so don't attack me. But then we are, as a scientist, we are very, very clever and we are very smart. So we take out these T cells and then we tweak them, retrain them with the help of a gene editing technology, which is a CRISPR-Cas technology. And then after that, put them back in the body. And now these cancer cells, T cells, are new T cells because they are retrained. And then they are going to attack to the cancer cells and say, hey, no, I am not under your spell. I am retrained. I know that who is the culprit. So I'm going to attack. So that's the kind of like a science we are talking about. Now we talk about medical cannabis. Of course, that like one of the important thing that like Dr. Hodge would completely agree with me, that when we talk about the medical cannabis, the first thing we talk about endocannabinoid system in our body, which is very, very important. So endocannabinoid system is one of the system in our body, basically that which is basically one of the system which maintain the homeostasis interacting with various different system in our body. Either it is like immune system, either it is the reproductive system, either it is the nervous system, you name it, digestive system, etc. And this CB1 and CB2 receptor, which is a part of the endocannabinoid system, is present in every part of the body, either the liver, brain, anything that you name it. So then what we get from there, that basically that like the endocannabinoid system has two roles. One is that preventive role, that means it play an important role in the maintain the normal physiological function of a specific organ, for example liver. But then if something happened to the liver, like liver cirrhosis or liver cancer, then the CB1 and CB2 receptor could be a very potential therapeutic target for liver cancer. And that's how that we correlate, because whatever the medical benefit we are getting, the whatever the patient Dr. Hodge is treating, is all about the byproduct of the interaction between phytocannabinoids and endocannabinoids. And phytocannabinoids means the product of the various different cannabis and cannabinoids and terpenoids and flavonoids, everything coming from the plant, it's called phytocannabinoids. And endocannabinoids, that means it is inside our body, which is have various different expression of CB1 and CB2 in various different organs, as well as body produce the several molecules which is called endocannabinoids. Anandamide and 2-AG are the major molecules. Then everybody asked to me and Dr. Hodge that if we have endocannabinoid system in our body, why we need phytocannabinoids? As I mentioned, that body is a very controlled mechanism. So that means that like when body sees something abnormal, then body release endocannabinoids, but in a certain level. And if that is not enough, then we can take the extra help from phytocannabinoid, that is the various different cannabis based product. So this is the basic understanding of how we can correlate the cancer and medical cannabis. Now, being said that I wanted to now understand from Dr. Hodge's perspective, in a clinical perspective, that Dr. Hodge, what do you think about that, like, and give us a little bit overview of that, like how medical cannabis is being currently integrated in the cancer treatment.
All right, and that was a great explanation of cancer. Thank you for the antibody refresher. That's really important to understand the new pipeline, what's coming out. Excuse me. just getting over that COVID. I'm glad it wasn't monkeypox, whatever foolishness is coming out. But back to your question, clinically in the world, what am I doing to help patients and caregivers? Well, we all know the mainstay for treating cancer is like chemotherapy, right? Now, chemotherapy is a toxic drug which does attack cancer, but it also attacks the good cells too. It doesn't differentiate between cancer, bad, and good. It attacks it all, and it comes with a huge myriad of side effects and adverse events, which are really unbearable. First will be nausea and vomiting, which really reduces the quality of life. And you have a patient that's fighting for their life, so they're taking this drug that helps and hurts them and reduces their quality of life. So it's a huge problem. Cannabis can help mitigate some of that nausea, where Zofran, a prescription for nausea, Phenergan, another prescription for nausea. And we know as clinicians that they don't work. All the evidence-based medicine says, hey, man, you can give them all the Phenergan and Zofran you got, but they're still going to be throwing up, nauseous, can't eat, upset stomach, bloated. But we still write it anyway. So many cancer caregivers, patients come just for the relief for nausea and vomiting. Second, we have to understand what kills people. What causes that transition when someone has cancer? So, because you explained cells proliferate out of control, right? Because of that P53 goes haywire, right? But what causes the death? So, as a clinician, I have to explain to caregivers and patients, like, look, 33% of cannabis patients will die from starvation or cachexia. So, more important than cannabinoids helping with the pain, helping with nausea and vomiting, random RCTs, we need larger studies, will show you that cannabis can help with cachexia, starvation, which kills, again, over a third of patients. And it's very horrible to watch someone you love not eat or drink. Even as a patient, even as their physician, it's still hard for me to watch someone just drop all that weight, can't get anything down. And I know the electrolyte abnormalities. I know what goes on when you don't eat or drink. And usually I let the patients, the family know, hey, they got less than a month to live. And within 10, 15 days without eating or drinking and watching your patient, watching that loved one suffer, they transition. So there's a lot of evidence that can help keep some of the adipose tissue on you. The side effects of cannabis also gives you the munchies, which can also help motivate you to eat a little more and drink a little more. So that's what I'm seeing that cannabis is doing. That's what I'm doing out here in the streets.
Thank you so much, Dr. Hodge, for your insights. That I think that it's really important for the listeners to understand that, as a clinical perspective, that what you are seeing in the clinic and what is the patient's perspective about the medical cannabis, what a clinician's perspective about the medical cannabis. So I wanted to summarize this for our learners, for our audience, that what Dr. Hodge mentioned here, that medical cannabis is not a magical drug, but it is a really impressive molecule from a plant which is doing amazing jobs from decades. It's not now that we, from globally, that we all are fighting to give the respect to the plant, that what the plant really required. So now that, like if we think about the modern medicine, of course, that, modern medicine is important. But then there are a lot of things like medical cannabis that which helps the patients to fight with the disease and then help the patients to be active and take those medications for their betterment. So, for example, if you think about that like medical cannabis in the field of cancer, that it has a, like I always talk about that like it has so much application in the field of cancer. So let's start with one and see that how many. So, and I can see Dr.
Let's
Hodge
do
is
it.
laughing because like he knows that like where I'm going, and it's amazing to talk about that.
It
Like
is.
we always talk about that. Like in the medical field, the sooner the diagnosis, better the prognosis, right? So if we find that somebody is have a benign cancer, then like medical cannabis can help as a anti-cancer activity, because cancer is a very aggressive disease. But then it reached up to a certain threshold and patient is starting chemo, radiotherapy, surgery, etc. So then like as Dr. Haj mentioned, that has a lot of side effects, because you are literally putting poison to patient's body, and then patients are depressed, because having cancer is a depression. And then after that, having a drug which is so harsh in your body is again a top of that like you are basically tired, you are depressed, and you have a lot of anxiety. So medical cannabis take care of anxiety, take care of your depression. So that means you are more healthy, you are more happy. And in the medical field, it's always and always suggested that if you are happy, your body is happy. If your body is happy,
Bing,
the
spot on,
body,
baby.
yeah. So then body is happy. That means the happily it will create a lot of energy for you to fight the disease. And that's what medical cannabis is giving you, the happiness, right?
Yeah.
And happiness comes from where? Comes from resting. So that means that like when you have anxiety, when you have a depression, you can't rest very well, you can't sleep very well. Medical cannabis help you to sleep so good. So that means if you sleep very good, that means you regain your energy, right? If you are not depressed, that means you are regain your energy. You don't have anxiety, you regain your energy. Three things are already done, right? Now you are in a right path. Now let's see that like what we can do. So then after that there is a pain. Then Dr. Haj mentioned he's a pain specialist, that like it can reduce the pain. Big thing is in the field of cancer biology is basically that like cancer cachexia and anorexia. It can control the cancer cachexia and anorexia, which is a huge deal for the cancer patients. And along with that, how it can be managed, because chemotherapy kill your appetite, it can boost your appetite. And if you eat good, you are happy. So that means it makes a big difference, that how it is basically like doing a lot of different stuff in your body. So just an example, in a very short summary for 5 to 10 minutes of discussion between me and Dr. Haj, you can
Yeah.
see at least 10 to 15 different applications of medical cannabis in the field of cancer, which shows the potential of medical cannabis in the field variety of different disorders, including cancer. So this is the summary, and there are new opportunities are coming, because like as I mentioned, CB1 and CB2, but there are a lot of receptors which are responsible for various different cancers. For example, HER2 receptors is responsible for the breast cancer progression, and now that there's a heterodimer which plays very important role, which is HER2 and CB2 are heterodimers as a new therapeutic option for creating various different small molecules to for the better prognostic tools for HER2 positive breast cancer patients. And there are a lot of clinical trials going on, which we are going to discuss after that. But in the field of medical cannabis, I think that there's a huge utility of medical cannabis. It's all about the perspective of the patients and perspective of the caregivers, perspective of the clinician. Now here is the question which is coming from Dr. Hodge. As a clinician working in the field of medical cannabis, how you think that when you interact with various different clinicians all over the country, including the state of Georgia, which is your home ground, that like uh, in today's world, even we have so much education, we have so much scientific literature, which is proving again and again and again that medical cannabis is the gateway drug. It is the better drug for so many different disorders, including opioid addictions, etc. How you see that, the perspective is changing in the clinicians?
It's slow, Dr. Bid. It's slow because they would, if the clinicians understood the oncologist, the cancer specialist, right? Um, I don't believe they're getting any cannabis training. Definitely, they're not. We didn't receive it in med school. We didn't talk about it in residency. And when they go to their specialty training, they hear gold standard in experimental drugs and still don't know anything about cannabis outside of Marinol, the FDA approved synthetic THC that they might want to prescribe for nausea for their patients if the patient and caregiver begs them. So if they really understood that what they are doing is part of the problem, um, they would sign up to make their own cannabis recommendations at their cancer institute. While their patients coming in and discussing chemo, they'll add that to their assessment and plan and talk about risk benefit ratios with cannabis, with chemo, adjunct therapy. They're not doing it. So it's really important that the series, that Dr. Bid, Yolanda, you create this catalog for physicians to follow, for specialists to follow, for them to copy. I don't expect them to reinvent the wheel, but just listen to this hour, and hopefully that will change your mind. But right now, they're not doing it. So I get lots of referrals from oncologists, from the VA oncology, because the federal VA still doesn't help the veterans with cannabis. And even with SHOA for pediatric cancers, for oil. Georgia's an oil-only state, so I'm telling the physicians, well, you're not telling your patient to go smoke. You're not telling them to go vape. It's oil only. This is 1 cc of cannabis oil. It's legal. I'm allowed to carry 20 fluid ounces of it. I explained to my my doctors, my colleagues, the nurses, hey, you squeeze like a little pin drop, half of a rice-sized granule, rub it under your tongue, and those veins, that plexus of veins and arteries under your tongue, they're going to absorb the medicine. It's going to work for up to 2 days. You need something a lot stronger, a lot more predictable, like an oil, to treat cancer. Because inhalation can cause coughing, and when someone is nausea, vomiting, stomach pain, the last thing you want to retching, the last thing you want to do is cough. That usually exacerbates the nausea and vomiting. So we got a long way to go. Thank you, Stanley, for the good question. We got to keep up the advocacy, keep up the work. The general practitioners and the family doctors are getting it, but as far as specialists like endocrinologists, hematologists, oncologists, they're slow. They're slow to the party. So again, let's create this catalog of great info because and teach them to think critically, Dr. Bid. I don't want to give people that they can look up on the internet. That's boring. Like, you can look up on the internet. You don't need Dr. Bid in that. His summary was spot on. There's a lot of things our body does. It creates, when we're under stress, it creates cortisol. Cortisol feeds cancer. He was talking about, your body happy. Happy is serotonin, dopamine. Cortisol hammers it down. And when your body's under stress, you're not getting any of that that serotonin, dopamine, epinephrine, all those feel-good chemicals, which actually not just make you feel good, like he says, helps with sleep onset, helps you stay asleep. And when you sleep, your body's cleaning up. That's when that P53 really kicks in, that little cancer check. Hey, cells start dying. Cell death curves that are apoptosis, during sleep. A lot of great things happen while you sleep. And That was a great point. But yeah, that's the answer. It's slow, Dr. Bid.
No, thanks, Dr. Hodge, for like indicating that point. And I've been kind of working in this field for a long time and throughout the whole country and internationally also. And I realize that that's a really a huge issue, that it is not the part of the medical curriculum. And one of the most important thing is to understand about the endocannabinoid system. And in our program that we teach endocannabinoid system in 8 weeks, and then it's kind of like it's such a big ocean that is so much information there that it is really a big deep dive you take. Then you understand about the endocannabinoid system itself. But being a clinician in the field of medical cannabis, we all need to understand, especially in the clinical perspective, that it's not only one thing. It's being to be successful in this field, you have to understand A to Z, seed to sale, the whole journey of the plant, that where is it start and where it ends. For example, that where the seed is coming from, how the plant grow, what are the different growing conditions are there, what are the different testing methods are there, what are the different extraction methods are there, and most important part is what are the different products available in the market. Because a lot of patients ask that, like, why there is so many different products available in the market. And my answer always is because there are so many different kind of patients are there, and we have to cover all of them, and every patients have limitations. For example, that one of the most controversial products that which always people talk about, why there's the suppositories. But that is the most successful product in the field of medical cannabis, because there are older populations which are the highest user in United States. And somebody has maybe the alcohol allergy, somebody cannot smoke, and somebody is not able to like take medical cannabis, but they can still use the suppository and completely fine with that and take the full advantage of that product.
Yep.
So that means the variability in the patients is so much that as a clinician you have to cover your patients, you have to cover all different kind of patients. There are patients, they have limitations due to the disease, and maybe the patient is not able to metabolize the gummies or etc. So that's why there are. And thanks for showing the oil, because that's very interesting for our patients to see, and newcomers, that what is basically that the products looks like. And the most important part, Dr. Hodge, that you mentioned is about that Georgia is like a oil based state, right? So
Yes, sir.
and we agree, me and you agree, that like that is the just the start. And it's very frustrating for a researcher and as a scientist
Damn
and
right.
as a clinician, that why just oil. We just talk about that we need different options to treat various different patients. So what do you think, that where is the lack and where is the challenge in the state of Georgia, that we got approval 2015, Dr. Hodge, and still we are sitting with a low percentage THC oil? Where is the gap, Dr. Hodge?
Um, well, we definitely started conservatively. The most conservative approach, if you're going to have a medical program in the country, is to do low THC oil. Um, we studied when we were looking to pass Haley's Hope, Dr. Bid. We went to, well, not me, legislators traveled to East Coast, West Coast, Midwest, and they loved the Minnesota model. So we pretty much copied our program after Minnesota, which was oil only. It advanced and now it's recreational. So hopefully this, Georgia's a part-time legislative state from January to March. I plan to lobby. I'm sure I won't be alone. I'm sure InfraMM, GMCC, everyone's going to be there lobbying to expand delivery methods. One, um, my fight is because it's medical discrimination. I'm a patient as well. Again, I suffer from intractable chronic pain with peripheral neuropathy, nerve pain. Uh, Oil is great, but you have to digest it. It takes about 30 to 45 minutes. When your liver hits it, it puts the hydroxyl group on it. have a greater affinity for your CD1 receptor, which can you can feel the adverse events of cannabis instead of an hour or 2 hours when I inhale or vape, it could be 2 days. And if I'm feeling those effects, I can't do a live with you, Dr. Bid. I'm losing time with family. I'm losing time with things I like to enjoy because of the adverse events when you do oral only. So we'll be lobbying. We'll be talking to the legislators, the Senate, the House of Representatives. Say, look, to get more aggressive, because legislators promised the state some tax returns from sales in dispensaries here in Georgia, and all of them are set up to fail with oil only because, again, I'm failing my patients because they're going to find flower vapes and edibles on the street because dispensaries don't have them, but they're not lab tested. I can't trust the labeling, the heavy metals. I don't know how consistently they're going to be able to source that same product, which is helping them. We don't know the date. I don't know the CBD THC ratio. I don't know exactly what terpenes are helping you. You see, lots of problems. But those patients and caregivers either going to move or they're going to still meet behind Amical, meet behind Quick Trip, meet the legacy person and get their medication. The dispensaries must match the streets for overall success of the medicinal cannabis program and to optimize therapeutic outcomes.
Yes, I think that, like Dr. Hodge, that what you mentioned is like right, spot on. And one of the most important thing I think that, like which is happening and, like it's continuously going to happen because we are educating clinicians, we are educating nurses, we are educating pharmacists, we are educating people, we are educating caregivers, and we are educating legislators the importance and value of this plant. And not only that, the states like Georgia, that like there are so many examples all over the United States of various different states, because 37 states are already approved for medical cannabis. They are showing to Georgia, look at this, the benefit of taxes, but also the medical benefit of cannabis in so many different diseases. It's amazing, and you should just follow. And the good part is that we are in a very sweet spot because the hard work is already done. Other states are already did the hard work. We have to just follow the things and like train the people that like to take advantage of that. One of the questions which always comes, Dr. Hodge, as we mentioned about the different products and being worked in a testing lab as a scientific director for 3 years in Columbus, Ohio, that I understand that the value of testing that you mentioned. And I think the consistency of testing in the field and the product, that consistency of the purity and potency of the product is the big challenge for the clinicians in this field, which we need to focus on. And definitely that like there are lot of actions going on throughout the whole country, and that I think that like which will help a lot. And now that there's a Dr. Litinas, that who is a medical cannabis expert and educator, good friend of mine, that what you suggest the dose and the treatment schedule for someone with cancer. And the question here again, that like when we talk about the dosing, when we talk about the cancer, again there are so many factors behind that, right? That like when we talk about the cancer, then you always think about that, okay, why the patient is coming to me and what he's expecting from medical cannabis. He's expecting to boost his appetite. He's expecting to reduce his depression, anxiety. Is he expecting that for hospice to reduce the pain and have a better quality of life, whatever he had. So it's a lot of these questions. But along with that, that as we mentioned that, it's a very complex interaction between the products and the human body, and everybody respond to different strains and different products differently, because everybody's
Yes.
expression of endocannabinoid system is different, our genetics is different. So then that means that, trial and error is the best way. But definitely that, as a clinicians, you have better ideas. I will let you take these questions and give your insights, because I feel like that there are a lot of patients that who are kind of like get more nervous about the side effects, like either it is, like dry mouth and, like little bit palpitation, etc. But again, that it's the I tell them it's the adjustment, because it's a new drug in your body, and your body is adjusting that. And the good part with medical cannabis is that, like no death so far, because even if you take 50 gram or, like whatever, that, like you just pass out, there's a no death. That's the
Yeah.
beauty of this. And the second
That's the
thing is that,
beauty.
like if you start more and you see that somebody is going towards the addictive properties, you can always cut down and then go to the zero, and then let the endocannabinoid receptors free, and then start from again zero. Then patient will start from a lower dose. That's the beauty of this medicine. But I will let you.
Great point. Great
Yes,
point, Doc. Thank you. Great point. You're
yes.
right.
So, so,
Um,
so give us a little bit about that. Like the dose adjustment and the treatment scheduling for various different patients, specifically focus on cancer.
for cancer, um, we definitely, during the daytime, I put them on high dose CBD, cannabidiol. Uh, if they're naive to THC, and just like you mentioned, the side effects, the lethargy, the high feeling, the cotton mouth, those are very self-limiting. I definitely explain to my patients and caregivers, hang in there. You hung in there with the opioids when they made you loopy at first, when you were constipated, when you started to numb emotionally, you continued to take them. You stayed compliant. In order for this to work, before the family leaves my office, we make sure that that verbal contract, that compliancy, that you're going to take this medication as we discuss for maximum therapeutic outcomes. So it's important that the game plan is something that one can access the drugs. They're going to be able to take it, again, stay compliant. I got to factor in hand dexterity if they are able to use a grinder. Some patients are too weak or they have arthritis. Primarily have cancer, but cancer isn't the only issue. They have multiple comorbidities. Um, I try to stay away from gummies and stuff that has sugar on it because sugar fuels cancer. Like cortisol fuels cancer, like lack of sleep fuels cancer. I still need my patients to exercise, so I can't have them too lethargic with THC. So again, I start with CBD 4 times a day, and I'm not talking 25 milligrams. I'm doing 100 milligram gummy or a tablet. I'm going to source for that patient, and you're going to start taking 100 milligrams Q4 to 6 hours. I slowly introduce THC oil or whole plant, whether you're going to vape it or you're going to decarboxylate with a good old flame. Slowly introduce that as well to help with the pain, because THC is really good for pain. It helps with the nausea. And as far as cell death, if cancer proliferates every 2 point something hours, uh, I want to start doing the THC at least 3 times a day for possible apoptosis, cell death, tumor necrosis factors, as you can explain. Once that patient is comfortable with the THC and no bad reactions, yeah, then we go heavy, bro. We go balls to the wall. as much as they can take. Because in the beginning, I was thinking cancer, this was the cure-all. Someone came in with breast cancer, cervical cancer, you had prostate cancer. I literally thought my success with my chronic pain, that you couldn't tell me this was going to help you, that the tree wasn't going to help you. And what I was finding, that it helped with some of the pain, nausea, vomiting, and the cachexia, but the patient still transitioned. So my whole approach after a year or two was to be more aggressive. Um, we can't wait for them to get a week or two, because these referrals are coming so late, Dr. Bid. These referrals aren't coming when patients are first diagnosed with cancer, or they first started having symptoms of fatigue. Maybe my skin is itching. My skin's been itching for months. I didn't know what it was. I've been dropping weight, or I don't have this energy. We're not catching them. We're catching them, when they're stage 3 and metastasis. It's different organs. It's in bone. It's in brain. Because now the patient has a sense of urgency. We did the chemo, we did the radiation. Doc, now I'm here to you. And I'm like, okay. Not final hour, but cannabis can only do so much. So the crux of the problem is getting these referrals too late, Dr. Bid. Mm-hmm. If they were coming when they were first diagnosed, when they first started, before they even rang that bell, before they even thought about ringing a bell with that 12th treatment, and I was able to, hey, alongside your chemo, alongside your radiation, then you're going to have surgery to excise it, or you're going to have surgery first, then the chemo and radiation. Start taking your oil day one. We can have a better conversation about dosing and treating. But right now, when they come so late, right now I'm super aggressive. And the patients and families are usually appreciative of that, because when they come to me, they don't have hope. You look in their eyes, you don't see any glimmer. You don't see any silver lining. You see zero hope, total dismay. So even the conversations of what cannabis can help with their cancer restores that. But without the hope, when hope is dead, your mind and your thoughts are very powerful, boss. Come on, everyone, listen. You got to know that if you don't believe, I'm talking your third eye, if you don't believe, man, it's over. So, yeah, referrals got to come early, and then we can have better treatment strategies. We can start even slower. We can go low and go slow, as the retail dispensary agent would tell you, go low, start slow. You got to be aggressive. That's it.
Yeah, no, I think that I totally agree with you, Dr. Hodge, that, it's all depends upon that what we keep talking about, that sooner the diagnosis, better the prognosis. The mantra is there. And again, that, the regulatory bodies and the regulatory complexities are also making the things difficult. But along with that, for clinicians, pharmacists to understand about the regulatory complexity and how to utilize for the patients is also a big factor. Along with that, for their education, that, to allow them as a doctor to use medical cannabis for the patients, need to be more rigorous courses from the state for them to understand that, what is going on. But there was again a question, I think, that from Stanley, that, often caregivers wait until the patient's end stage before restoring to medical cannabis as a last resort, as Dr. Hodge mentioned. That definitely, because, that's the big issue. And then you have to take the aggressive approach. And before that, you can titrate low and slow, and then you can see. And why low and slow? Because in the medical field, that, you learn, Dr. Hodge, always that, how in a minimal dose of a drug that you can treat the patient, right? So then
Absolutely.
yes, so if you start with the medical cannabis in the beginning and low and slow, so that means you are not losing that window where that patient can maybe need like maybe 0.5 milligram, and then their endocannabinoid can be triggered, and then everything will be all good. And there is always the opportunity to increase that. And as I mentioned that, when we see that as a doctor, maybe, like there are opportunities there that when you see the patient cases, that a lot of patients are coming, and then continuously when you are treating them with a time of a 6 months, 8 months, maybe 1 year, you see that that patient need more dose. And even though it's not a very bad disease, maybe it's a kind of like a pain, etc., but on the other hand, that it's give you the opportunity and the indication that there is something wrong, because he need more dose, more dose, more dose. That means there are the two possibilities: either the receptors are saturated, so they are not kind of like just circulating around, and other thing is that the addiction part is maybe kind of progressing in a little bit in that area. So what, as a clinician, I need to do, I need to back off, I need to cut the dose slowly to go to bring my patient to zero, and let the endocannabinoids free, let the receptors free, so that the patient can start responding with zero point 0.5 milligram again. And that's the beauty that you cannot do with the modern medicine.
Facts, bro. Facts. Like, we're like Stanley's spot on. It's last resort reflex coming from these oncologists, or the patient's just tired. Like, the chemo's not working, and let me, instead of going to Costa Rica for this experimental surgery or treatment, let me just try some medicinal cannabis. But these referrals are coming so late, I gotta sometimes source suppositories so I can give them the highest dose possible without causing adverse reactions, even though some hits the liver, but all of it doesn't. I mean, that's how late these referrals are coming, and that's how aggressive I'm trying to be to improve the situation, you know?
Yes, I think that that's the important part that you mentioned, Dr. Hodge, that the more the late they get, that there's a less opportunity to take the advantage. But definitely that we all agree that in today's talk that we need more education. We need to
Right.
educate each and every end. We need to learn A to Z, seed to sale. We need to learn, and we need to teach not only the clinician, not only the pharmacist, not only the nurse practitioner, but also caregivers and the patients, so that they know the benefit, and they can ask the right question to the clinicians like you, that, hey, Dr. Hodge, I have this pain, I learned about medical cannabis, and I think that these are the different strains will be good for me or my skin, eczema, etc. So please let me know, because please illuminate me with your knowledge, that like what I learned, that is it true or not. Because as a clinician you are practicing, but I'm also trying to learn. So when there is a coordination between the patient and the clinicians on the education basis, on the science basis, that yes, I am learning, I know that what's going on in various different states, what are the different products are there, it makes the whole process so smooth, and it's helped the clinicians so much. What's your thought about that?
Oh, bro, you're spot on, bro. That's what we need to do. Start educating super early, because other than that, we really can't collect the data for the ascension of cannabis and cancer treatment.
Yes.
Um,
So the
the
most
earlier we
important
start,
part,
the more data we got, and now we can start
yes,
making better recommendations for the
yes.
whole world.
Yes.
For sure.
And one important thing, Dr. Hodge, I would like to mention here, because I've been kind of working in the cancer drug discovery for such a long time, decades, that like I know that a drug which is coming from a laboratory with the in vitro in the cell lines, and come to finally to that point where FDA approved that drug and go to the patient's body, it takes like years, like 20, 30 years. But the beauty with the medical cannabis is that it is giving us the opportunity to directly utilize in the human body. We don't need like animals, we don't need preclinical models. We have human models. But
That's true.
the important part what you mentioned is data recording, data tracking. So I think that it is really, really important for the most of the dispensaries all over the country to have that data, the patients, the training in the clinicians to create that survey to collect the data that, like, hey, I treat with this combination of terpenes as well as the cannabinoids treats very well with that stage of the cancer. And then, when you publish that data, then that makes a big difference to the other clinicians to give a reference material that, oh my God, there's already a reference material. I know that what Dr. Hodge is doing. I know that Dr. Hodge just now published that he's treating with the pain, but he also understands that there are some medications which interact with medical cannabis, which is called drug-drug interaction, because medical cannabis, CBD and THC, the major constituents, have effect on liver metabolizing enzymes. Then Dr. Hodge mentioned that please don't give these medications within this hour and make a gap so that, like, patients can get the advantage of both the medication in the same time and be recovered very well also. And that kind of information is invaluable. That,
it's gold, bro.
It's a really valuable information. So I think that overall that education is the key to success. We need definitely more education in each and every aspect. As I mentioned, that not only medical cannabis, but we are thriving in the nation for the scientific discovery which is happening with respect to various different kinds of medical cannabis. Either it is the acidic cannabinoids, either it is the neutral cannabinoids, either it is verenic cannabinoids. And then on top of that, that consumers don't know or have the knowledge or don't understand that where is the source to understand about the terpenes and terpenoids, that these are the crazy ones, right? And then
that was
after
my world. That was my life in the beginning. The legacy guy is going to tell, like, I can spell out, hey, take the CBD, and the patient will call me like, hey, what do I do with this? And I want to say, light the end or swallow it, but you got to be nice. Now, when I was trying to treat myself, you think I can call the dealer and say, hey, man, what's in this ounce, man? What's the CBD? No, they're not going to tell you. They don't even know the answers themselves. So the education is paramount, bro. There's no other way. And you're right. The ECS and lab testing must be the focus initially. And once everyone can agree on that, and once every state does it the same way, it's uniform, we're going up. We're going up. But that's what I want people to go up. I want them to live their best life, be the best version of themselves, like you, Dr. Bid.
And I think, like, as I mentioned, that purity and consistency in the purity and potency will change this field drastically. But we are not there yet, Dr. Hodge. We are not there yet. But we all are working together as a team. We are all working together as a team. We are opening new programs. We are opening new episodes like today's episode. And we are opening new program at Morehouse School of Medicine that, the master's program, Medical Cannabis Therapeutic.
Huge for the South, baby.
Yes. Which is creating the leaders, which are creating the knowledgeable scientists in the field, which are the forefront leaders, and who can support the social equity part of this aspect also, which is really, really important to consider, because from the beginning that, I think that, that's also one of the thing that we can always talk about later, that, really important to consider. So summarizing the whole talk, that I think that, it's already 7 o'clock, and it's just, medical cannabis has a huge application in the field of cancer. And as we discussed, that there are not 1, 2, 3, there are at least more than 10 applications in the field of medical cannabis, and there are amazing benefits. There are a lot of ongoing research going on. There are a lot of clinical trials going on, that which is trying to figure it out, that, with combination with modern treatment of chemotherapy, that, how medical cannabis can help the patients. And it was a wonderful discussion as always, Dr. Hodge. And thank you, in spite of that you are not feeling well, that thank you for being with us. Thank you for sharing your amazing knowledge in this platform to the patients. It's been a wonderful evening today with you.
Man, always a pleasure, Doc Bid. I always learn a lot from you, and it helps me think critically more critically, how I can be a better advocate for cancer patients, and let's create more cancer survivors.
That's for sure. That's for sure.
The prevalence is increasing with cancer. Young adults are getting cancers, which I thought older adults got. Um, so yeah, it's really us or else. It's educators versus them.
Yes. Thank you so
So
much, Dr. Hodge,
yeah,
for today's discussion. And for
peace.
the listeners, and for the audiences that tune in for the next GMCS Masterclass with Dr. Bid, Medical Cancer Essentials. Next episode, join us September 26th for an enlightenment discussion with Dr. Carly Bell Biggins. And then we are discussing in many different aspects of medical cannabis moving forward. Thank you so much for your time and looking
Peace. We'll
forward
do
for
it
the
again.
next episode. Thank you.
Peace and power.
Have a good day.
GMCS Masterclass, Medical Cannabis Essentials, produced by the Georgia Medical Cannabis Society, brought to you by our dedicated volunteers and generous donors. Special thanks to Dr. Rasean Hodge for sharing his expertise. Support our cause to keep programs like this going. Donate today at georgiamcs.org. The Georgia Medical Cannabis Society is a 501(c) nonprofit, and all donations are tax deductible